While periodic paralysis is a significant part of our lives, it is only one part of who we are. How do we live fully beyond the diagnosis? To answer that, it's my pleasure to introduce a first-time periodic paralysis conference presenter, Dr. Knoll, for his session, Beyond the Diagnosis, Living Well with Periodic Paralysis.
So my name is Dr. Knoll. I am a licensed clinical psychologist. I live in Michigan and I work there. A lot of my clinical experience has actually been working with veterans from the U.S. military, but I've had the opportunity to work with a broad range of people with various medical problems, and I have specialty training in clinical health psychology. Invited here to present. I'm really privileged to be here as the first-time participant of the Periodic Paralysis Association. Not because of my direct professional experience treating people with periodic paralysis, but by a personal relationship with someone who has that condition, who has a vision for expanding people's awareness of kind of understanding the full person and how can we learn to live and manage well chronic disabilities, knowing that that plays such a powerful role in our lives. I've worked with people with medical conditions like various neuromuscular diseases, Parkinson's disease, HIV and AIDS, metastatic cancer, end-stage liver disease, and across all that experience, I've really learned a lot about how much physical health problems can directly impact our ability to live our lives and how important it is to pay attention to those concerns, to get meaningful support, and to facilitate healthy communication with our medical providers so that you can live a more full life and really feel like you're in the driver's seat of your life even when you have those concerns. My goal today with this presentation is really to help raise that awareness of how behavioral health and mental health factors can impact living a life with chronic rare disease like periodic paralysis, so that patients, loved ones and caregivers, medical providers, researchers can all better understand their role and how they can better support people in that community. I'm going to reference a couple times today just an example of an individual I worked with who has a lot of overlap with symptoms and experiences of people in the periodic paralysis community. So I'm going to give just a brief kind of summary of a veteran I worked with who still really holds a special place in my heart. His name was Tony. He was a white male Vietnam veteran of the U.S. Army. Tony and his wife, one of the favorite pastimes they used to have before I met him was a competitive swing dancer. So he'd do these wonderful competitions. It was a hobby of his. It was something that they really loved doing together. But I was requested to consult with him as part of a home-based primary care team coming into his home to provide services because he was really struggling with depression. He had been diagnosed about 3 years prior with amyotrophic lateral sclerosis, or ALS. Known as Lou Gehrig's disease. It's a rare, terminal neurodegenerative disease. About 1 in 23,000 people will have ALS in their lifetime. There's no cure. Average life expectancy is about 3 to 5 years after diagnosis. When he first started having symptoms, he was struggling with problems like some twitching, cramping, occasional falling, tripping. By the time that I met with him, he was struggling with low mood, low motivation, had lost control of his ability to walk and was wheelchair-bound, very frequently homebound, troubles with speech and swallowing, and was starting to lose kind of strength in his arms. Rarely left bed, and he had really started isolating from people in his life, including his wife. He had kind of shunned himself from people around him, and the home-based primary care team was trying to figure out how can we support this person, knowing that he has no history of mental health problems, never seen any treatment for that prior to his diagnosis. So I'm going to circle back to that later and kind of talk about the ways that we can learn from a patient like this. Even though he didn't have periodic paralysis, I think you'll probably find that some of the correlates there might relate to you or resonate with you. Generally, this is my outline of what I want to cover today. First, understanding just the scope of the problem. Why am I even here? Why is this something that I was invited to speak about? Some of the functional impacts of mental health issues and behavioral health factors that affect periodic paralysis. I want to draw attention in particular to some of the interventions that you might be able to do to better manage it, and also just ideas for advocacy. I know we were going to have someone presenting more on that later this afternoon, but I'll probably try to provide a psychological perspective on that as well. If you haven't already, I am going to check Whova a couple times and use that. I put together some polls just to get people's perspectives because, as you'll see, so few research studies have been published understanding the scope of mental health issues in people with periodic paralysis specifically. I want to make sure that that's something I kind of draw from the audience here to get your ideas about your symptoms. Broadly, if we look at the general population, we know that a lot of people in their lifetime will experience some type of mental health disorder or mental illness. About 1 in 5 have met condition criteria in the last year for some type of mental health condition, and as many as 1 in 3 in the general population will meet criteria at some point in their life. That was based on a study that was done looking at data from 1980 to 2013 across 63 different countries. This is a global phenomenon. In general, those studies have shown women are more prone to mood or anxiety disorders, whereas men are typically more prone to substance use challenges like alcohol use disorder. It's worth noting that I have not been able to find a single study that actually looks at the specific prevalence, either for the last year or lifetime prevalence of mental health conditions within periodic paralysis specifically. At least not looking at any that involve quantitative data. There have been a number of case studies coming out. I did kind of ask people today, like, what kind of symptoms have you experienced? So far, out of the 57 people who've replied, we've got chronic fatigue and sleep problems as highly frequent. 35 people have said that was relevant at some point in their life. Feeling sad, down, or depressed. Poor attention and concentration, 29 out of 57 people, so more than half have experienced that, as well as forgetfulness, poor memory. So these are very common issues among a lot of people. So why should we care? Why is this potentially going to impact people? We know that depression in particular, but mental health broadly, is a significant burden on people's lives, both in terms of quality of life and economically. When we think about some of the costs of how depression, for example, affects lives, we found that over the course of 2010 to 2018, the estimated economic burden of depression on livelihood increased to $326 billion. They estimate that by looking at a variety of direct costs, like money spent on patient care, doctor visits, workplace costs is really a significant area. Think about any time that you felt down enough that you didn't feel like going to work. Or if you ever felt like you had to show up to work, but you weren't actually feeling healthy enough to be there, but you felt like you had to go anyway, think about how that affected your productivity, your ability to do your job well. And then in the case of depression in particular, suicide-related costs, just the loss of life, and how that can directly impact just broad communities, agencies, families, right? It's worth noting younger adults are disproportionately kind of represented here. I think the age group that we've seen really grow is the age range of 18 to 34, which actually also coincides with the age that a lot of people are when they first get diagnosed with periodic paralysis, just listening to some people's stories, and so we see that there are some kind of overlaps there. Depression has actually been rated as the single largest contributor to non-fatal health loss globally. Of all healthcare conditions out there, depression is actually one of the most burdensome. Right? If we look at a variety of surveys, people with rare diseases in particular have significant costs in how it affects their quality of life, more so than people with common chronic diseases. Especially people who had multiple rare diseases. I've talked with some people just today even who have multiple conditions. People who are lower income, older age, who've had symptoms longer, all typically have significant lower quality of life associated with just having those conditions. Interestingly, they found that shorter duration of diagnosis is actually a significant predictor of worse quality of life. And just hearing from some people today, that makes sense. Sometimes getting that diagnosis can help you better understand what's going on, can help you feel validated. And some of the people, even who just literally spoke here, saying that the longer they've had that diagnosis, they've started to learn how to manage it better, right? In particular, we know that lots of people with periodic paralysis take a long time to get an accurate diagnosis, and that's part of the struggle. One study I found from 2013 was specifically looking at hyperkalemic periodic paralysis. They had 66 participants. In general, found that they reported negative impact on work performance. It was one of the single highest and most common concerns, but ability to do well in school, ability to live a meaningful family life. just their overall health and wellness and relationship. I had a person already reach out to me today just saying that they've been really struggling with their family concerns since they've been pregnant, because we actually find that in this study they found 91% of the women reported having increased attacks and intensity of their symptoms while they were pregnant. There's a lot of significant changes there, and just someone reaching out saying, I don't know how this is affecting my family. I don't know how to navigate this well, and I'm worried my kids are going to feel really affected by this. I think that's a very meaningful question and concern. One of the most common reasons why periodic paralysis gets misdiagnosed, from what I've read, is really because it gets attributed to a psychiatric or psychological problem. That idea that it's in your head. And as a psychologist, I hear this a lot of the clinics I've worked in, recognizing that, I firmly believe that even though this is very clearly a physical problem that's rooted in your body, as a psychologist, I believe that your head can be part of the solution and trying to understand, how can I live differently when I'm really struggling? It's also worth noting that extreme transient fatigue, irritability, mood problems, sleeplessness, we already heard from at least one other provider today who shared, when these episodes hit me, I'm exhausted. Sometimes just needing to take a really big nap. Imagine how that could affect your quality of life. Right? When it comes to interventions and being able to actually do something really meaningful, I like to highlight that it's important that you assemble a healthcare team and have people involved in your care who are using evidence-based treatment. There are a variety of evidence-based or science-backed treatments that exist. There are a lot of practitioners out there who offer more of what I would call kind of supportive counseling, or where it's a chance to sit and talk and feel heard and validated. It is a highly important, meaningful service. When it comes to more chronic or pervasive mental health challenges, I do believe that it helps to have treatment that is really evidence-based, because I believe that these conditions can really improve. In fact, research studies have consistently shown that as many as 70 to 90% of patients who live with depression, anxiety, or insomnia in particular will eventually achieve lasting improvement and successful symptom management if they get the right treatment. I have met a lot of people who have not gotten the best treatment because they didn't know what was out there. I've listed a couple by name that I encourage you to check out if you want to learn more. But I always believe that getting good care when it comes to mental health treatment means making sure you're getting the same level of information you would expect from your other specialists. They should be able to tell you the type of treatment they're offering, how they're measuring success, and that they're monitoring that regularly. Signs of evidence-based treatment from a mental health perspective typically means they are using a specific modality or a treatment manual or protocol, that you should have an expected number of sessions that this will likely take, be able to get answers about the general benefits and risks of the treatments you're participating in, and that you should feel like every session is spent moving closer to goals that you have set that are really informed by your values. If you don't feel like you're getting that yet, then it's probably worth asking some questions of your providers. I have found a lot of providers in mental health realm are using evidence-based care, but maybe don't articulate it well that patients understand. So a good way to take care of your treatment planning with your provider is to ask those questions. Is there a name of a particular treatment we're using, or a theory that you're using to inform your work? Why are you recommending this particular treatment? Generally, for the average person, psychotherapy and medication management are really comparable first-line treatment options. Largely comes down to preference. There's been growing research that the use of vigorous exercise routinely has also been as effective as therapy or medications in the case of mild to moderate depression. But when we take a look at periodic paralysis and I think about some of the unique contributions, we already know that recovering from exercise can actually be a particular trigger, right? So that starts to hamper some of the things I might recommend for someone. Relative research exploring particular recommendations for people with neuromuscular diseases or with specific conditions really doesn't exist. There's very few research articles out there that are really rigorously done that have explored specific treatment guidelines or how they selected these. Really, it's a lot of case studies. In general, though, we find that people as they age may be at higher risk of systemic complications for medications. And so generally, I would say psychotherapy may be a relatively more effective option than medications for someone with a more unique, rare medical disease, mostly because of the potential benefits versus risks may be better. I do strongly recommend you talk to your providers to make sure you're thinking about some of those options so that you can understand what might be helpful for you. In terms of specific interventions, though, I'm going to walk through a couple that I like to use with a lot of the people that I work with that I think would also be particularly helpful. In fact, you've probably even heard people talking today about some things that I was nodding along thinking, yep, as a psychologist, I think this is great advice. So I'm really glad to hear that you're probably going to see some similar trends or echoes here in what other people have already shared. I am a really big fan of strategies that are what we call externalizing skills. When we can take the thoughts and the feelings we have in our head and get it out in a meaningful way, it can make your ability to cope with that much more effective. It can help you take a more logical approach or rational approach to coping with distress. And it can also really lead to better ability to advocate for yourself and to kind of feel more heard. Journaling, we talked about today, food diaries. We talked about creating logs of your health care. We heard from several patients living with this condition who shared how keeping personal notes can be really valuable, and I absolutely want to say I love that. Absolutely want to echo that. When I work with people who are trying to better manage their chronic conditions, I highlight this because no one knows more about you and your life than anyone. No one knows more than you on you, your life, how you're living, and that is the part that's really vital when it comes to communicating with your healthcare provider. These are trained professionals who have academic knowledge, but they don't know what it's like to be in your shoes. And although I can ask someone general questions like, hey, how's your sleep been the last few weeks, right? If someone comes to me and gives me quantitative data that they've been tracking and can show me a timeline of how things have changed, it can give me way more useful information to have more nuanced assessment and treatment planning, and it can help me know what interventions might be more meaningful. I have a guy I'm working with right now who has panic disorder, and when we started meeting, he was having 2 or 3 panic attacks a week. Over the last couple of months, he's gone down to having maybe 1 every other month. By using exposure therapy and learning how to change his thinking process when he's having panic attacks. He uses some of the most basic apps on his phone to track this. He's got an iPhone, he uses a calendar. Anytime he has a full-blown panic attack, when he's kind of calmed down and feels more like himself, he'll add it to his calendar. He'll add details in there about what he experienced, what was going on. And then has also used things like the journal app, notes app, to write down what his potential triggers might have been, what thoughts came up when he was experiencing that, and then we use that as conversation tool and starter when we have our sessions. And he's been able to say, yep, in the last 6 weeks, I've had 2 times where my anxiety got higher, and then 1 time I had a full-blown panic attack, and this is what was going on and what I think I could do about it. I love that. Imagine if you go to a doctor and you're trying to talk to them about your episodes of periodic paralysis or your attacks, and someone says, well, how are you managing that? You're like, man, it feels like it's been really bad lately. I've been having a lot more issues. Versus if you can come in and you can say, in the last 14 days, I have had 2 different attacks. On average, they're lasting 30 minutes to 60 minutes. I noticed on these days I would rate my fatigue jump from a 3 out of 10 to an 8 out of 10. And I noticed that when I tried taking a nap, that didn't help much. I noticed on the days that I missed my dose, my fatigue was particularly higher. I've already tried melatonin. I've been tracking my sleep score the last few days. I've noticed that that hasn't yet made a significant change. I'd really like to learn more about ways to help me with my energy and my sleep. Do you have any recommendations? Right? Sometimes small amounts of data can be incredibly valuable for advocating for yourself. So I'm a really big believer of that. I also want to point out 2 other journaling strategies that can help with coping with emotional health challenges in particular. So expressive writing is writing about your thoughts, your feelings, how you're reacting. So maybe you had a bad day and you're feeling like crap, and you want to just take the time to write about that. I have a lot of people I've talked to who say, well, I don't want to talk to my family about that. I feel like I'm already a burden. The beauty of a journal is it's not going to judge you for how you're feeling. You can write that stuff down, process that internally. It gives you the tools to be able to work through those thoughts and feelings. Gratitude journaling is another particular strategy that I haven't heard anyone mention today and may not have heard about. Has anyone heard of this topic before, the idea of gratitude journaling? A couple, awesome. So gratitude journaling is an idea of writing about specific benefits that you found, things going well, trying to cultivate a sense of optimism or hope, and then being able to keep a log of that. Even on a rough day, being able to say, at least I'm really pleased that I had my family member there to help me through that. Or I'm feeling really grateful my service dog was able to help me with this attack, and I was able to kind of nip it in the bud before I got worse. Or even though I wasn't able to work today, I got this really great message from my boss who was really supportive, and that made me feel better. When we actually take the time to cultivate gratitude in this way, it's been shown to have not just psychological, but physical benefits for people, including long-term improvements in immune system functioning, lowered cortisol levels, improved psychological functioning and sense of well-being. So I'm a huge fan of those strategies. I think it goes without saying that being connected with people is really critical. And as we've talked about today, just having people in your corner is really an incredibly important factor with managing stress. It's part of the reason why this conference exists. And one of the things I love about it the most, I've been really most impressed, just seeing the way that people engage in their community here. I always want to add to that teaching people about your conditions can actually be a source of strength, and it can be a way of self-advocacy. So being able to say to someone, how you live with this, teaching people about it can help you feel more confident, more empowered. It can inspire other people. I'm a firm believer in the idea of kind of taking ownership of chronic medical conditions rather than feeling like a victim of them, because it leads to better well-being. There have been a number of research studies showing that social support leads to better sense of self-efficacy. There are a couple of different research studies that have pointed out there's really creative ways you can do this. You don't have to be limited. Even if you struggle with permanent muscle weakness, you have a hard time sometimes leaving the house, or you're having attacks that keep you laid up for a while, internet really can be a powerful way to connect with people. I mean, we have people literally coming here today from India, the United Kingdom, from around the world, and your ability to connect with other people who share your concerns, who've been there, who get it, cannot be underestimated how powerful that is at feeling supported. But even things like gaming with people, a variety of self-care mobile apps, using social media in a meaningful, positive way to connect with other people, are really great strategies that I really do recommend. One other intervention that I think can be really valuable is called mindfulness. Mindfulness has been thought of both as a kind of philosophy, but it also can be a particular skill that you can cultivate and practice. One of my favorite definitions I found of it is by John Kabat-Zinn. He says it's paying attention in a particular way, on purpose, in the present moment, non-judgmentally. And I think that's a really important thing. A lot of people in the moment, if you're having an attack and you can't move and you have a lot of strangers wondering what's going on, you're probably having a hard time being non-judgmental in that moment about how you feel. I've talked to a lot of people who struggle with feelings of shame or guilt or anxiety, the fear of, am I going to need help from someone I don't know? How can I get the support that I might need? Mindfulness to me is about transforming your relationship with your internal experiences and the world around you. If I can learn that this isn't just a disease that is my identity, but it's a condition that I live with, and that I'm able to recognize that instead of, for example, having thoughts or feelings like, this isn't fair, I wish I was normal, if instead I could kind of have this experience of saying, this is just something I'm experiencing right now. I'm noticing that my legs are weak, right? There's a big difference between I hate my body and I'm noticing right now that I'm having an attack, or I'm noticing weakness set in. Describing it almost objectively. I've talked with some of my patients. It's almost like, imagine if you've got like a little label sticker maker, right? And you're walking around your brain just kind of labeling what that thought is, what that feeling is. You're just describing it objectively. It removes some of the judgment and the stigma that you might even be ascribing to yourself, and it can have a really big impact on your ability to sit with those thoughts and feelings. It's important. This isn't just about passively accepting or resigning your situation. It's not about giving up. This is actually a form of empowerment. It's just being able to say, okay, I have this condition, I have this symptom, I'm having this struggle, today I feel depressed, what do I want to do next? And that's a key part of mindfulness. I'm going to talk a little bit now, going back to Tony. So the particular treatment option that I discussed with Tony when I met with him is called cognitive behavioral therapy, or CBT. This is, if you've been in mental health treatment or have researched it at all, you may have heard about this. It is one of the most kind of prevalent or contemporary approaches to psychotherapy. I met with him about every 2 weeks in his home. I was working on a team that was able to go and do home visits for people who were homebound. It was a really great service for him. So just thinking about some of the skills already that we've talked about, and then I'll touch on a few other ones I haven't mentioned yet that I used with him. Really one of the most important things we did first was just building a relationship and trying to help him understand how ALS was affecting him. So many people he lived with, talked to, medical providers were kind of avoiding the conversation about life expectancy, about kind of how his disease affected his symptoms. A lot of his family felt uncomfortable discussing it with him and tried to pretend it wasn't a problem and just ignored it when they could because they didn't want to upset him. And a real part of what we discussed was, how can you better understand how it is? And acknowledging that, in fact, many people with ALS and neuromuscular diseases really struggle with poor mood, poor cognition, that kind of fuzzy thinking, and he found that incredibly validating. In fact, he was pretty tearful our first few sessions just talking about the fact that he had ALS and what that meant for his life. One of the most effective strategies that really helped him was what we call cognitive restructuring, or paying attention to your thoughts. I've heard it described, a neat kind of phrase here that might help you remember it. It's the idea of catch it, check it, change it. So the idea of catching it is you're noticing when you're having a strong negative feeling, you're having a bad day, sifting through your thoughts and then asking yourself a couple of questions. Is this thought true? Do I know this to be true? Is it accurate? Is it helpful? Sometimes thoughts are very accurate and there's no denying them, but they're really not helpful. I worked with a guy once who, his spouse of 40 years had passed away, and he had the thought, I miss her horribly. Yeah, you do. I understand that. But then he went on to say, well, I have no reason to get up in the morning, and I just don't really care if I live anymore. And it wasn't helpful for him. It wasn't helping him live his life, and his family was really worried about him. In Tony's case, one of the number one feelings he had was actually guilt. We started talking about it. He's like, I feel guilty. I feel like I'm letting my family down. I'm leaving my wife behind. I know that I'm going to pass away, and I feel like I'm a burden on her. And I feel like she's had to become a caregiver, not my spouse. And I feel like I can't burden her anymore with my feelings. And that was the main reason why he wasn't talking to her. And so what we started talking about was recognizing, okay, that line of thinking might not be very helpful. Even if that's genuinely how you feel, is that thought leading you to engage in the things that matter to you the most? And he's like, no, absolutely not. I recognize that. It was leading to avoid one of the people who had the most positive impact on his life. And so when we reframed it, he was able to articulate, instead of having that thought, I'm a burden, having the thought, I just want to make the most of what time I have left with her. I want to really be able to do everything I can. The other strategy that really worked for him is called behavioral activation. I jokingly like to call this the Nike method, just do it. It's an oversimplified summary, but a key idea of behavioral activation is that when you struggle with chronic depression in particular, can you find meaningful activities that give you joy? Things that you can still do within your power realistically that give you a sense of pleasure or make you feel accomplished in some way, right? And so for him, he was really not able to realistically get out of the house that often. He certainly wasn't able to dance anymore. But what he and his partner started doing, they just started sitting out on the bench and watching the sunset and just chatting. Started bird watching, actually, which he found really fascinating. And as he started kind of having more issues with his hands, being able to hold binoculars, his wife would do it and describe what she was looking at. And they just talked. They pulled out some of their old home videos and started laughing about it and watched some of their old competitions and who they thought was the better dancer. And that time they almost won, and man, I wish it could have gone differently, right? We were able to get some in-the-home care so he could actually start engaging in more personal hygiene, which is actually incredibly helpful for him. It made him feel like a different person, right? Think about the last time you went, a while without showering because you just felt like crap, and how sometimes something as basic as brushing your teeth, taking a shower can actually really lift your spirits, and it gives you this momentum to get up and do something different. So that was really powerful for him. A key thing that I want to think about, when you have a chronic disease like periodic paralysis, same thing with Tony, he couldn't change his diagnosis. He couldn't change the fact that that was something that was now part of his life. He couldn't cure it, and he knew that it would eventually kill him. right? So we said, what can you change? What's within your power? What can you do differently that might be really helpful for you? And that helped him take a more optimistic perspective, and it helped him start to resolve some of the real problems he had. We were able to get a ramp installed at his home so he could get out more. That's something we could solve. And that helped him then go do different activities that were meaningful. And then relaxation training. There's a lot of wonderful apps out there. I had quite a few people who commented on the Hoover app talking about ways that they actually really kind of cope with these symptoms, and they actually kind of similarly mentioned some of those skills. I had several people who mentioned breathing relaxation, different meditation strategies. Let's see here. I had someone talk about trying to change the things they were thinking about, not dwelling on their illness. I think there's a difference between avoiding the conversation and giving yourself some healthy distance from it. Sometimes just taking a break and doing something pleasant. Prayer, quiet space, being in nature. Several people on here mentioned the idea of journaling, which is great, but also things like art. If you're able to and you have the muscle strength on a given day, creative expression is incredibly valuable, right? Someone here said crochet, doing puzzles, taking a nap, spending time with family, right? So there's a lot of strategies. I'll publish these results for people so you can check it out and see what other people have said, but there's a lot of great strategies out there. So what should we do next? I think one of the most critical things that medical providers need to think about is that this is a highly prevalent concern among your patients. I asked this question of which symptoms have you had, and so far out of 67 people, one of them said none of these problems have been relevant. But a broad range of people have endorsed some of these concerns. And as we said, as many as 46% of people with a chronic rare disease will have depression in their life. It's way higher than the regular population. So you need to be mindful of that. There was a study in the UK that came out a couple of years ago. They found that almost half of people had never had anyone ask them about their mental health. Looking at 50 people here today from our group, 14 of them said someone has never asked them during their visit about their emotional well-being. 8 people said rarely. So we're looking at 23 out of 51, it's almost half, have been asked rarely or never about their emotional well-being, when we know that it's a highly co-occurring problem. And we know that conditions like high levels of anxiety can affect stress levels like cortisol, which can have significant impact on things like your electrolyte balance, right? So we need to be more mindful of that. I would encourage you to ask those questions of your patients if you're a provider. And if you're a patient and you haven't broached this topic, I would encourage you to bring it up. Owning it and finding ways to talk about it can be really valuable. I think I'm slightly biased, I think having a behavioral health provider can add a lot to a team. There's been research kind of showing that actually there was a Germany study looking at a center for rare disease. They found that in the span of a year, about 19% of teams that didn't have a behavioral health specialist were able to get to an accurate diagnosis, and it was 42% for those that had a behavioral health provider. Because they were able to find a way to rule out, is this really a mental health issue, or is this maybe a symptom of a larger issue that is more explained physiologically? Plus just the general satisfaction. They found that the overall satisfaction of care was significantly higher in the group that had a behavioral health specialist embedded in the team. So true interdisciplinary care isn't just people being on a team together, it's collaboration, being able to work together and be on the same page and having a seat at that table. So I do encourage you, if you're part of a healthcare agency, to maybe think about, is this something we're adequately addressing? And is there a way we could do more? In particular, I think medical researchers really should think about additional ways that they could target clinical guidelines and safety monitoring for pharmacotherapy or medications. There was a research review that found between 2002 and 2022, there were a total of 26 articles that talked about medication use for mental health treatment for people with neuromuscular disorders. In just the last year, I did a quick search, I found over 100 for ALS. And ALS is a rare disease. Right, and that's not even to say things like diabetes, obesity, hypertension, heart disease. There's way more research being done in some of those conditions for how it could affect specific issues. But this one is, I think, to me, a huge gap between the need and the knowledge literature that's out there. So I would encourage people to be asking those questions. So that is what I had. I'm glad to take time for any questions or concerns or anything else I can do to support you. But thanks for listening.
Well, Dr. Knoll, thank you. We've got some questions that were in app, and I'll share them if it's okay with you.
Yeah.
My daughter, 18 years old, has been struggling with anxiety and depression since her hypo-PP and chronic pain started about 2 years ago. She sees a psychologist and a psychiatrist. Do you have any tips for managing her mental health, considering the daily pain and ongoing weakness episodes last about 7 days?
I saw that question. The fact that these are lasting so much longer, 7 days. I mean, I can't imagine how much that would impact your quality of life. When you think about the typical 18-year-old, right, of what you want your life to be looking like, being engaged in things in high school or college. For someone who's already established with mental health care, I think that it's really important that you be asking those questions. How do the providers feel treatment is going? Are they monitoring treatment response? Do you or does your daughter feel like you are getting the attention you need? Sometimes you need to try more than one treatment or a specific treatment approach, or you maybe need to try a combination of therapy and medications, or maybe you need to trial a different medication. And so starting by asking the questions, can we take a step back and ask ourselves, how is the treatment plan working? And what room is there for change, right? Maybe that person needs to trial a different medication, or maybe they and their therapist need to consider consulting with another provider for a trial of a different treatment that person's not trained in. I'm not trained in every form of therapy, right? And sometimes it's okay to acknowledge that maybe I'm not the best person to help you, but maybe there's a different way I can, right? For example, with anxiety, depending on the case, like exposure therapy is one of the most effective types of cognitive behavioral therapy. The success rates for the average person are very high, but it's so infrequent that providers have been trained in that. So making sure that you're getting the right access to the right care. But as I kind of talked about, I think recognizing that managing a chronic condition is more like a marathon than a sprint. So focusing on how can I live my life well, what is within my control, how can I try to improve my quality of life today and tomorrow and this week, and just take it day by day. So those are some things I would think about.
Thank you. Another question, very popular, upvoted. How do you live alone or work a job with hypo-PP that can have daily
Great
episodes?
Question. Yeah. And in fact, a lot of the people who participated in the polls kind of commented on how they've had to either give up work or stop working. So I'm a manager in my role. I work with a team, and I've had a lot of training in recognizing the roles of disabilities and reasonable accommodations. We live in a post-COVID era where a lot of people may be able to find either work accommodations or jobs that allow you to still function at your best while working around your disability. And a good manager and a good HR team at your company should work with you to figure out a way to make that possible in consultation closely with your medical providers. So I think about things like being able to do telehealth services. Can I get a reduced workload if that's necessary? I've done FMLA paperwork to be able to take intermittent leave, and you're eligible for that, right? You might not be able to always predict when an attack's coming, but if I can, no questions asked, take a day off with my provider and say, or my employer and say, I'm having an attack today, I need to take the rest of the day off, and you have that FMLA coverage. Like, there are ways to work around a disability. Those are the things that I would start by asking those questions. And I think I would ask your providers, my goal is to work, right? I need income to support my family, or because it gives me personal satisfaction. How can I make this work? Dr. Hart talked about a wonderful example of that with his family, right? When you have the goal, you've got that in the long-term goal in mind, then every provider should be working with you to ensure that you're moving towards that. And work can be feasible for many people. Yeah.
And if anybody in the room has one, great. And let me get this one where we're going. What's an ideal medical team to help with diagnosis and continued care of a PDP? And nephrologists currently neither are experts but are understanding and listen. They're willing to try things, looking for help if I had a specialist. Yeah. Any thoughts on that? You were talking about kind of a building out a team.
Yeah, I think the most important thing is that you have providers you trust and respect, that you're getting meaningful answers and you feel like you can open up to them about what's going on. Unfortunately, not every provider out there is like that all the time. So if you really feel like you're in a rut and you're having a hard time, I think that's really important. I think a really good team should include providers who are willing to take time outside of your visits to communicate with other providers. I find in my experience a lot of behavioral health providers are like that, especially psychologists, again, slightly biased. But I know that if I had a patient come to me and said, hey, I have periodic paralysis, can you help me, and can you coordinate with my providers, I would want to bend over backwards to accommodate that. So I think you want to look for providers who are willing to take the time to research your condition, to understand it, and then use their knowledge, specialty knowledge, to offer meaningful feedback or referrals as needed. But I think in general, I mean, the science shows that behavioral health problems are really popular. So having someone that you could talk to about that could be very meaningful. Obviously, a really good medical provider who's either willing to take the specialty kind of feedback in consulting with someone, or who has personal knowledge of how to treat that professionally would be really valuable. So, yeah.
Hello, sir. Sorry, I've been in and out. I've not felt the best coming in here.
I know.
So I'm not sure if you actually covered this or not, but it's another question outside the purview, I think, what you talked about. Growing up, I was really, they pushed a lot of more psychological problems on me than having a neuromuscular disease where metabolism affects the mental health in that regards. So I know that's one thing I was hoping maybe you might have touched on. I might have missed it. If not, if you
like people like misdiagnosing or like saying this is in your head,
or because they tried pushing me years ago to I was bipolar, I was possible schizophrenic, then to missing the aspect of now that it's dealing with autism, ADHD, but on top of lightened episodes with my muscular disease going up and down.
Yeah.
In the regards, though, too, it makes me wonder, has it kind of been talked about, and this question was asked by somebody I met today that they've got a younger son, dealing with adolescence and puberties, with already our metabolism changing as it is, mental health, if you don't address it correctly, or what's the best way to get it addressed correctly? Because at the time of puberty, your chemical imbalance is already changing, and it's also then affecting mental health. How do you approach service providers, psychologists, or in that regards to say, hey, we need to also kind of help round this out together versus just throwing medications at it? That's what happened to me throughout the years. They just kept throwing medications at me. And even to this day, I still need to ask that because it does affect my mental health where they just want to throw medications at it instead of just trying to deal with both sides.
Yeah. Great question. So kind of how do you navigate the issue of being kind of told this is in your head or feeling like you're being maybe gaslit by a provider or told it's a psychological issue? And then also, what do you do when you feel like you're not being heard or respected by providers, and how do you communicate with them so that you can have a better kind of care? Yeah, I mean, show of hands, how many people here have felt that way, being told it's in your head or told that your medical problems weren't real? I mean, you're probably in pretty good company here. Right? Unfortunately, it's a very common issue. I was really struck just looking at the data. The average rare disease time between symptom onset and diagnosis is about 6 or 7 years, just as a rule of thumb. But with periodic paralysis, we're talking 19 years, 26 years, one study. So it's a very common issue. Yeah, I think that's where I was saying giving clear symptom description when you go to providers, being able to take personal data, track it, journal it, and show up and say, these are the symptoms I'm having, these are the factors I've observed, can be really critical. I would always recommend you ask your providers, what are the options available to me for my symptoms? What is the diagnosis you're recommending and why? What conditions have you ruled out and how? What options are available to me? What are the benefits and risks of those options, and why you're recommending this particular one given my personal health history? And a good provider should be able to answer those questions thoroughly. And it can also help you push them if you feel like the options they're using without your, discussion with you. It can help you have a more pointed conversation and give pushback so that you advocate better. Yeah.
All right, can we give a round of applause and thank Dr. Knoll?